Today, we will be taking the chairman's remarks to kick off. We'll also take the technical updates from the Honorable Minister of Health and the National Coordinator before we take your questions, and then the responses will come. So at this point, let me invite the chairman of the Presidential Task Force on COVID-19 to please make his remarks. SGF, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, good afternoon. I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Tuesday, 12th May 2020. Today, the Presidential Task Force participated in the commissioning of a 300-bed treatment, testing, and isolation center along with a 54G laboratory in Abuja. The facility was powered by a consortium of like-minded partners, and on behalf of the Presidential Task Force and the entire nation, I say a very big thank you to the Sahara Energy Group, the This Day Media and Technology Group, COVID, AFC, CCECC, NMPC, and the Central Bank. The world is in the midst of a dangerous pandemic, and one key solution to it is collaboration and partnership. The power and benefits of partnerships have been vividly demonstrated in the Jack Ma support, the United Nations One Basket Fund, the interface with other nations, the intervention by individuals and corporate citizens within and outside Nigeria. The list is endless, and we say thank you to all of these partners. As we continue to learn the lessons from COVID-19 by fortifying our health systems and infrastructure against present and future pandemics, I wish to remind Nigerians that there is still a lot to be done and investment to make. The Presidential Task Force mentioned at the briefing on Monday, yesterday, 11th May 2020, that it had commenced focus on community ownership, guidance, acceptance, and implementation in the control of COVID-19. This certainly requires a great deal of investment in strengthening our primary health care system, the manpower, and the infrastructure. I therefore call on other cooperative citizens and public-spirited individuals to play significant roles by injecting the much-needed investment into the rural health infrastructure. Given the impact of COVID-19 on global economy and our national income, it has become obvious that government alone cannot bear this burden. Since the recording of the index case, Nigerians have clamored for research into homegrown solution to COVID-19. The Presidential Task Force, as part of its mandate, has continued to promote research and wishes to repeat its appeal to all our researchers to go through the validation process so as to enable humanity benefit from their hard work, and they in turn benefit from the intellectual property rights associated with such research. The Presidential Task Force on COVID-19, at virtually all its national briefings, consistently pleaded with Nigerians for their support and understanding, especially in complying with the advisories and guidelines issues. We also shared our assessment of the level of compliance and the risk associated with non-compliance. I wish to use this medium to once again underscore the imperative of collective survival, because the lack of compliance by any person or group of persons poses a threat to all of us. Particularly, the Presidential Task Force has become aware of the ongoing practice of sharing masks and picking of masks from recycling or recycling from dump sites. This places a lot of responsibilities on all of us to be self-educated and to educate others. The following points I emphasize. With the exception of fabric masks, every disposable mask used is a hazardous medical waste and should be disposed of properly, preferably by burning. It is very risky to share masks, as the virus is capable of remaining on surfaces for several hours, and you could get infected through the processes of sharing masks. 3, the unhealthy practice of picking up disposed masks for whatever purpose is harmful to both the individual picking it and whoever procures it later. Particularly, it will be helpful for high-risk people, such as elderly and those with comorbidities, to wear masks or face covering and avoid crowded places. As we reminded you earlier, please keep grandchildren away from their grandparents to avoid transmission. Most importantly, emphatically say no to stigmatization. Let me say once more that the primary responsibility of government is to protect the lives and property of all citizens. On the other hand, citizens have a duty to collaborate with government by shunning risk and actions capable of jeopardizing the protection provided. We shall continue to put in place strategies and measures targeted at flattening the curve of this coronavirus, while at the same time urging and persuading you to comply. Our messages are being delivered in different languages and through multiple mediums. The Presidential Task Force continues to urge state governments to align their actions and enforcement with the guidelines provided. The virus does not respect boundaries, neither does it respect status. All state governments are therefore urged to strengthen their monitoring and enforcement machineries in collaboration with the security agencies. Let me emphasize that we have seen visuals on the social media depicting total disregard for physical distancing in some locations. This is a dangerous journey towards uninhibited spread if not checked. The Presidential Task Force is consulting with the authorities of the identified areas to review their strategies. You will recall that the guidelines on the reopening of offices directed the management of such offices to take certain steps and put in place policies that would ensure the safety of their staff. Let me remind the leadership of various offices to make sure provisions are made for the following: infrared temperature guns at entrances, sanitizers, hand washing facilities, social distancing arrangements, and ensuring that masks are worn always. This is particularly critical for government offices in high concentration areas such as the Federal Secretariat Complex. We similarly admonish individual staff to cultivate the habit of personal safety first before depending on the general provision. I now call on the Honorable Minister of Health and after the National Coordinator to update you on developments. And I thank you for listening.
Good afternoon, everybody. The Secretary to the Government of the Federation and Chair of PTF, Honorable Ministers here present, Directors General, ladies and gentlemen of the press. As at this morning, the 12th of May 2020, 242 new COVID-19 cases were confirmed in Nigeria, giving us a total of 4,641 in 34 states of the Federation and the Federal Capital Territory, with unfortunately 150 fatalities recorded. 902 cases have happily been cured and discharged from care. The 242 new cases reported are as follows: from Lagos 88, Kano 64, Katsina 49, Kaduna 13, Ogun 9, Gombe 6, Adamawa 4, FCT 3, Ondo 1, Oyo 1, Zamfara 1, Borno 1, Bauchi 1, and Rivers State 1. The Federal Ministry of Health is working with its agencies and other organs of government and multinational organizations in continuous efforts to control transmission with tried, tested, and innovative measures. The nature of this outbreak, as we have observed in other countries, is such that the sustainability of any strategy may be challenged as time goes on by evolving realities at home and also across the globe. We must therefore be ready to adjust to the situation as it changes. To reduce our burden, we encourage organs of the state maintaining vigilance at our borders, including our port health services, to keep up the good work and not to tire or to relent. The Federal Ministry of Health has been closely monitoring and reviewing the unfolding situation in some states where COVID-19 appears to have gained ground. We had responded to the situation in Kano by dispatching a team of medical experts that is providing technical support to the State Ministry of Health. I am pleased to inform that the team has done very well in their assignment and has reported a lot of success in helping to stabilize the state's health system, to assuage the disquiet among health workers who are going to restart routine service delivery, particularly immunization, antenatal clinic, and so on. No new infections of health workers has been reported in the line of duty in recent times due to all the training and retraining that has gone on. And those who have recovered from their infection are awaiting certification to resume work. A Federal Ministry of Health delegation of experts is presently in Bauchi State on a fact-finding mission to work with the state government and look into reports of unexplained deaths in Azare, Bauchi State. Other high-burden areas or states grappling with epidemic control issues will be offered the same support. We have recently had such delegations visit Jigawa and Katsina State, where needs have been identified, and we are looking at ways of supporting Katsina State with a 54-gene laboratory, as was displayed today, to reduce turnaround time and waiting time. In this connection, I also wish to commend the ongoing initiative being developed by the Governors Forum to rally available human resources for health volunteers from some states to support high-burden states with manpower shortages. I'm encouraged by recent conversations with Their Excellencies, the Governors of Lagos State and Ekiti State on this subject. The Federal Ministry of Health, through NCDC, has already printed the mandatory institutional quarantine guidelines and NCDC crew kit for returnees coming in from the diaspora. As we have continued to ramp up COVID-19 testing capacity by adding 3 new molecular laboratories to our network, Benin City and 2 in Port Harcourt, which brings the total number of facilities with molecular laboratory capabilities to 25. An expert advisory team is to be set up to assist with our audit of laboratory processes with a view to offering suggestions on strategies to reduce testing turnaround time and other issues of matter of interest to users. The number of isolation centers and beds nationwide is increasing, and has already been mentioned by the chairman, with the This Day Dome commissioned in Abuja today, is providing the most comprehensive panel of medical services for COVID-19, including lab testing, ICU, and dialysis. It was handed over to the Federal Ministry of Health and the Federal Capital Development Authority, and it signals a landmark in collaborations between public and private sector to fight this common enemy. The center has wards and ICU center with ventilators, has X-ray, mobile X-ray, and it has the dialysis center. The Gene Expert Testing Mobile Laboratory is there, complete with reagents, scalable from 200 to 1,000 tests per day. It should significantly reduce the waiting time and also the turnaround time in the Abuja metropolis. A hotel and conference center was donated by another philanthropist next door to the dome for use by medical staff who are working inside the dome, and this conference center will be available for a period of 6 months. The CBN medical grant in direct support of Federal Ministry of Health and FCTA for day-to-day management of the isolation center is also on offer. There is an industrial-grade medical incinerator on site for managing medical waste. Laboratory services in this center is no doubt a great boost to testing capacity and will enhance our capacity to handle confirmed cases and reduce frustration that has been reported in this area. We shall make this facility operational within the coming days. I want to use this opportunity to thank all the donors and the sponsors of this very wonderful facility. I also use the opportunity to enjoin state governors to continue to ensure that they reach the isolation capacity target of 300 beds in every state of the Federation minimum, while also calling on philanthropists to support their state's efforts, including expanding the capacity for tracing, testing, isolation, and treatment. So I conclude by thanking all our countrymen and countrywomen for their sacrifices they have made and are still making. This is all for the good of all of us. And I also want to remind you of the injunction to wear your masks, especially if you know that you are going to somewhere where you cannot avoid crowding. If you are going to the market, going to a public event center, to wear your mask so that if you meet anyone who by any chance is positive and not known to you or to the person, you do not become a victim. I also urge you all who are wearing cloth masks to make sure that your mask is properly washed every day and sunned or ironed to reduce the risk of transmission and retransmission. Thank you all for your attention.
The Chairman of the PTF, members of the Presidential Task Force, ladies and gentlemen of the press, good evening. I want to first of all start briefly by talking about the Madagascar cure, because there's been a lot in the press recently. As directed by Mr. President, I want to state again that any medication coming into the country, whether it's a herbal cure or concoction or a proper drug, has to be subjected to the normal regulatory process. The Madagascar cure will be subjected to the normal process we expect within the legal frameworks and guidelines that we have, more importantly, to not only to establish the drug efficacy, but also the drug safety. As stated by NAFDAC, no drug and related product can be manufactured, imported, exported, advertised, sold, or distributed in the country unless legally registered. So this drug will go through the normal expected process, which will be quite stringent before it can be administered to anybody within the country. In terms of interstate travel, the PTF continues to see disturbing trends where vehicles are carrying large numbers of people across state borders. The movements of people across state lines is actually against the lockdown process. We urge the public to please refrain from interstate travel. Only travel that is essential or travel involving the conveyance of essential goods is allowed. Movement across state borders is fast-tracking the dissemination and spread of the COVID-19 pandemic across the country. We are also advising state governments and security agencies to increase those measures and surveillance required to keep people within the state borders. Finally, in terms of public sensitization, we will continue to appeal to the public to please abide strictly to the eased lockdown guidelines. These guidelines are for our own safety in order to limit our exposure to the virus during these times. We are calling on all persons who have symptoms consistent with COVID to please get in touch with the NDC through our helplines, particularly if you feel you may have been exposed. It is only by ensuring absolute compliance and cooperation that we can overcome this hurdle. Thank you.
Thank you. We will move quickly to the question. Okay.
Good evening, members of the PTF. My name is Juliana Taiwo. I write for Sun newspapers. My first question goes to the coordinator. The PTF keeps expressing worry over non-adherence to guidelines, especially keeping social distance. Will it be out of place to let people know where we have prevalence of cases, for people to know that this virus is real? SGF, sir, the second one is for you. Last week, my colleague from AIT did ask questions about the issue between HACO and SACO members being at loggerheads at the ports over cost, demurrage cost. The issue is still on. We'd like to find out if there is an update, because they are saying that should this be allowed to go on, the cost will be transferred to ordinary Nigerians. Thank you.
The chairman of the PTF and Nigerians at home, I want to ask the My name is Mitaire Ikwen. I report for NTA. I want to ask the chairman of the Presidential Task Force. I understand during this pandemic that a lot of Nigerians who lay claim to having cure for coronavirus prefer to circulate such claims on social media rather than presenting their claims for validation. Although this is not to say that a lot others are not coming for validation, but we understand that the cost for validation is about 20 million naira. This is quite a huge financial burden. That's why I'm asking you, the SGF, sir, if the PTF is thinking of reducing or subsidizing this cost, especially where there are reasonable claims for homegrown cure for the coronavirus. And again, for the Minister of Health, you told us some days back that a third test will be carried out on the Benue lady, Susan, suspected of coronavirus. And I want to know if this test has been done, what is the result, and why did she need to be tested 3 times? Because a lot of people who are certified COVID-free are usually tested twice. So we need an answer on that. Thank you.
Good afternoon all. My name is Friday Okeribe. I'm a reporter with Channels TV. I would like to direct my first question to the Minister of Health. You told us here some weeks ago about the estimated numbers of health workers that were infected. During your brief, you just told us that some of them have recovered. I'd like to know how many health workers have recovered that are waiting for recertification before they return to work. I'd also like to know what the PTF is actually doing with the warning it issued at the beginning of the relaxation. Some of the warning include that those who fail to use face masks and those who violate some of the protocols, like the one about interstate travel, will be prosecuted. And now we keep seeing the PTF appealing. What has happened to that? Was that just a mere threat? Or why have you not prosecuted anybody? And lastly, too, on this platform, the Minister of Humanitarian Affairs have constantly said she will go ahead with the feeding of school children, even though they are at home. Now, the PTF has not advised against it, even though we know that the register that the minister has, that they are using in feeding the children, only has information about the names of the pupils and also the school that they attend. There's no information about where their address. There's no information about their phone numbers. So why is the PTF not discouraging that, knowing that it will be difficult to actually locate these children at home? Thank you.
Good afternoon all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. So how many private hospitals have we accredited so far, and what has been their challenges? My next question is for the Minister of Environment. How many environmental health officers do we have in our airports, land ports, and seaports? And I would also like to know, this is for the coordinator, sir. I would also like to know how many disease surveillance officers we have across the 36 states. Thank you very much.
The Chairman, the National Coordinator, members of the Task Force, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question goes to the Minister of Health. Well, sir, you've just told us that you have received the report as to the unexplained death in Kano. So when can the public really get more information concerning what was discovered? Because we're now seeing a similar situation play out in Yobe, Katsina, and the rest. So we would really like that to help us, understand what is happening. And my next question goes to the National Coordinator. Well, sir, you spoke about sometime last week that those who have relatives who unfortunately have lost their lives not due to COVID, you said this can be tagged as essential travel. Well, some Nigerians want to know the protocol involved in them getting the pass to be able to take their dead relative home for burial. And the final one is not a question, it's more of a suggestion, and it goes to the chairman of the task force. Well, Nigerians have said, for the fact that we're seeing a lot of violations on human rights here in the country that unfortunately has been attributed to members of the security force, that it would be nice to have, just like we had the IG of police join you here, even if it cannot be a part of the PTF every day, at least once a week, to get Nigerians to really talk about what they're facing out there. Thank you.
Good afternoon, all. My name is Abbas Adebowale Jimo from Daily Trust. The first question is for the Honorable Minister of Health. The medical and consultant physicists who are in charge of treating the cancer and related cardiovascular diseases, they complained they were not mentioned during the insurance and palliative for health workers, despite being part of the front line that attend to underlying ailments during the treatment for the COVID-19. They want their case to be addressed. The second one is that, also for you, sir. Okay, the medical physicists, consultants and medical physicists taking care of cancer and other related ailments. And they are also part of the frontline health workers taking care of treating the COVID-19 cases as part of the underlying ailments. They said they were not mentioned when you roll out the MOU, taking care of the interest of frontline health workers. So they want their case addressed. The secondly is also that the Nigerians wanted to know the updates on the Chinese medical experts in the country. What have they been doing? If they are here, they wonder why we still have to be reaching out to the medical personnel in Beijing, China, when they have representatives here that we can interface with. Then this is for the chairman, sir. The Hotel Owners Forum, Abuja, they said they've written to you offering their properties free of charge to the government as isolation centers. And here they said that it was announced here that they were not cooperating with government to leave their properties for this kind of a noble cause in the name of the country. Thank you very much.
Good evening, sirs, SGF, honorable ministers, my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. My first question goes to the Minister of Health, sir. Sir, my colleague with the news agency of NAN shared an information with me, and I also verified that the Kogi State Commissioner for Information was quoted today in the media to have said that the state has procured antigen-based rapid test kits for COVID-19, and I've also commenced the use of these test kits for rapid testing. Now, are you aware of these, and where is the meeting point now between the PTF and health authorities in Kogi State, and talking about ensuring that as the standards of biosecurity is maintained in carrying out all of these tests? And the second question would have been for the Minister of Interior, but maybe the SGF can take it, sir. It's about the movement of Almajiris. I know you have said that, you have spoken about that often in the past, that this movement is banned in line with a ban on interstate movement. But the question now is, what happens to these Almajiris? We've seen them turn back from states. When they get to the borders, security operatives intercept them and turn them back. But we don't know what happens. Where did they disappear? Where did they go to? People are wondering, and people are saying maybe they might have found their ways into other communities. Are we keeping a track on this? Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question goes to the national coordinator. There are concerns by some Nigerians about the congestion in the market, which makes it difficult for people to observe the social distancing advisory.
Don't the PTF think it is high time to consider opening more markets, like expanding the market to address the social distancing advisory? Secondly, this one goes to the SGF, sir. I want to know the update on the 2 trucks of cattle that were arrested by the Rivers State government last week. Thank you.
Thank you. We have taken all the questions, and we'll be taking responses now from the Honorable Minister of Health, the National Coordinator, the Honorable Minister of Environment, and the SGF. We start with the Minister of Health.
Okay, thank you very much. The questions that came in, the one about the lady at National Hospital, who we have been engaging with. The history, I think, is already known, that she came in from the UK and has had 3 tests. She is due for another test, which she has refused to take. And we strongly believe that she is quite by now definitely negative, but we need to be able to document it, because we also work with guidelines and work with the guidelines released by World Health Organization, which we follow. But in order to document it, I called her on phone and persuaded her to just let them take the test. And she gave me the condition that first they must give her all her results from the past. Then she will agree just to take a specimen. Those of you who have done it here know how simple it is. And I gave the instruction. They took all her results, photocopied all of them, and gave them to her. But on the day of the test, when NCDC got there, she told them that she wanted the test to be taken by World Health Organization. And then that the test should not be done in Nigeria, they should send it to UK to go and do the test. So that seemed to be a very difficult order. It demanded that it must be done in the UK and that the specimen must be taken only by WHO. So it's becoming a very odd drama. It was reported to me, so I called her again and I said, why have you changed the conditions? You said you wanted your results, you have your results. And she wrote a text to me saying I should consult her lawyer. She has taken a lawyer. So that was just yesterday, I think. So we're going to continue with the lawyer business. But it's only just to document that she's okay and to leave. But it seems to be a drama that is playing out there. So that is the situation with the lady. But she's quite well. She's in good health. And the hospital authorities have also done their very best. Now, with regard to health workers who have all had the COVID-19 and other treatment, they are tested and then retested and then usually given a period of time before they are certified fit to resume work. I can't give you a direct number, and they are not all in one place, so I can't give you a count if you're asking how many. With regard to accreditation hospitals, yes, we have developed a protocol for accreditation. They have been given to many of the states, and special teams go along to go and help. Like the team from that we sent to Kano has already been to about 4 states in the north to help to set up the accreditation. The government hospitals, the teaching hospitals have been examined and accredited, and some state hospitals, but private hospitals, some in Lagos have been. I can't give you an exact number either. But they are accredited by the accreditation team of the state. Now, with regard to the investigation from Kano, it is going on a very scientific investigation. They take all the evidence that they want, and then they sit down to collate a report. They're trying to make sure that there's no room for error and for dispute. So I've not received the report yet, but I'm sure it's on the pipeline. Now, with regard to other unexplained deaths in other states, what I have told the team is that they should invite pathologists from many of the states who are reporting these high deaths and to have hands-on training in Kano. So they have got pathologists now from Sokoto, I think Bauchi, Jigawa, about 4 or 5 pathologists who have arrived in Kano to develop a protocol and develop a training by which they can now carry out these investigations in the areas where the reports have been made. As I speak to you, a team is in Bauchi, in Azari, doing just that, looking into reports of unexplained deaths. They are not clear. They are using the protocols. Where they can take samples, they do take samples. Where it's possible to take samples, they take samples and send them to test. As I said during my statement, one of the needs identified is a need, particularly in Katsina State, where there are lots of, there appear to be some backlog in the samples taken that haven't been generated. We are looking at a mobile laboratory for that state. Now, with regard to health workers and the hazard allowance, yes, the hazard allowance has been worked out for all the health workers. The NMA was present, consultants were present, all of them are present, so the deal is already made, it's signed. It has gone to the Minister of Finance, and I think it has come back. Minister of Labor is there. I don't think anybody is complaining. Now, about procurement of test kits, anybody is free to procure test kits. If you find test kits you want to use for yourself, you can try it. But the point is that the Ministry of Health has said that the validity of rapid diagnostic kits is not guaranteed. It is not very reliable according to all the reports we have. There's a high margin of error. So the acceptability of those results is questionable. Those who want to use it probably as a guidance. It tells probably those who have recovered or those who are exposed. And yes, with Cross River State, we are waiting for flight to be able to go to Calabar. We have had a good discussion with His Excellency Governor Ayade, who has worked out a plan for the Ministry of Health, including NCDC and primary health care, to help to go into Calabar and work out, bring the systems there to be the same with the rest of the country, so that we have one response, which is what somebody was asking of the other day, one response for the whole country. I think that's all. Thank you.
Since the first one had to do with the issue of non-compliance and what the PTF is doing about this, and I think it dovetails into the other question about whether the PTF is a toothless bulldog. So with all epidemics or pandemics, you need the support of the public. Without the support of the public, no matter how much you try to enforce, it will just not work. And that's why we have been working with community leaders, our traditional and religious institutions, to make sure that this behavioral change that we are trying to push through is successful. Nevertheless, we're actually quite pleased, and we do support state agencies that have been implementing fines, penalties for people who have been violating the guidelines. And we'll continue to work with the public. This is all about behavioral change. It's not easy if you are curtailing people's freedom when people are used to doing things in a particular way. But the most important thing is to ensure that there is enough awareness going on, and we're all aware of the risks that we are taking by breaking the guidelines, especially by going out when we don't have to, not maintaining physical distancing, etc. In terms of people subjecting their claims to scrutiny when it comes to drugs, again, the PTF does welcome innovation, especially if this innovation will lead to new therapeutics. There's no doubt. But as I said earlier, drug development has several phases. You have the initial discovery and development phase, you have preclinical and then clinical studies, and then you have regulatory review. And after licensing, you then look at post-market survey to make sure that there aren't any antecedent side effects that had not been noticed during the period of drug development. And this will apply across the board, regardless of whether it was discovered during a pandemic or it was discovered during a period when there was no urgency. We will continue to work with the different arms of government to make sure that the regulatory part of drug development continues to be valid purely for the safety of our own people, more than anything else. Another question had to do with pass for essential travel. So yes, if you do need to travel for essential reasons such as bereavements, feel free to email us on PTF COVID-19 at osgf.gov.ng. We will need evidence in terms of documentations, and we'll provide you with clearance. We have already been doing this. This is part and parcel of what our secretariat does. So it's PTF COVID-19, all one word, at OSGF, which is Office of the Secretary to the Government of the Federation.gov.ng. If you write to us with the evidence in terms of documents, we will get back to you and we'll be able to provide you with a letter that will allow you to travel with your loved ones. The issue of congestion in the market and the need to expand the markets. Well, expansion of markets isn't really part of the PTF mandate. This is a local thing, but all I can say is that we continue to monitor and review quite closely some of the guidelines we have produced. You're probably aware that by the end of this week, we'll be coming to the end of the second week of easing the lockdown, and we will be taking further decisions based on the review of the performance of the restrictions that we have in place, and we will not hesitate to change our strategy if it looks like it's not working. Thank you. Sorry, Rachel, you have, what was it? Well, Rachel, I'm afraid I don't have that number, but we can certainly find out for you. We can ask the relevant people and then get back to you, okay? Thank you.
We will now take the Honorable Minister of Environment.
The question is, how many environmental health officers do we have at our borders, land, air, and sea? Beginning with the land borders, we run 3 shifts of 8 hours, and we have 2 environmental health officers per shift, making a total of 6 at land borders. Our air, that's airports, we have 8, again 3 shifts, so 8 per shift, making a total of 24 for airport times 3. The same thing with the land sea border. We also have 8 per shift, 3 shifts, making a total of 24 covering any land border. So it's 886 for airport, sea, and land. Thank you.
Thank you. We shall now take the SGF. Okay. And there was a question for the Minister of Humanitarian Affairs. Can you come and repeat the question?
All right, the question is about the school feeding program. And the information is that the register that the ministry relies on feeding the children contains information about their schools and their names. There's no information about where they live, that is their home addresses, and there's no information about their phone number. So how is it that the ministry will still be able to feed these children that are at home when there are no such information? Thank you.
Thank you very much, the chairman of the PTF, members of the PTF, and distinguished ladies and gentlemen of the press. We mentioned earlier that this school feeding program that we are directed to carry out even when schools are locked down, we had consultations with the state governments. We have a structure on ground that provides this school feeding intervention to these children. We have the aggregators, we have the cooks within the locality, and we also have the school management. Now we're talking about localities where these children come from. And I know that in each locality where we have these schools, most of these school children, they know their homes. They know where they come from. So we are targeting these homes where these school children come from. We're giving this voucher to these households that are being identified as where the children, the school pupils are. And they come to the distribution center to pick this dry food ration. We don't need to have their phone numbers. It's a small community where these schools are, and it's like everybody knows everyone in that community. They know the children that attend this public school, and this is the structure we're using. We're using CSOs, we're using NGOs, we're using security operators, the DSS, the ICPC, the EFCC, and all the security structures on ground to make sure that these things are being properly monitored and evaluated. We have just flagged up the inspection of these stores and facilities where this food have been taken to, and by Thursday, God's willing, we are going to flag off the FCT food distribution to these households where these children come from. Thank you very much. I said dry food ration for 1 month. Thank you.
Thank you, Honorable Minister of Humanitarian Affairs. We'll take the SGF now.
The first question is a follow-up on the matter of demurrage, especially as it relates to the conflict between NACO, I think, and SACOL. I had reported that to the Honorable Minister of Aviation, who promised that he was going to be here today to give a clarification in respect of that, but unfortunately he's indisposed. But I can assure you that we'll follow up on that and he gives the clarification, because that had to deal with his industry, so I defer to him, being a member of this committee, to give that explanation. So that will be given. But I know that the one that has to deal with issues of demurrage regarding the maritime industry, we've spoken about it here, and I got confirmation then from the Executive Secretary of the Nigeria Shippers Council that had been waived. I don't know whether the situation has changed. That's with regards to the maritime industry. This one has to deal with issues of aviation, and like I said, I've thrown that back at the Honorable Minister of Aviation. I think he will join us tomorrow, and he should be able to give clarification in respect of that. Well, the other question has to do with subsidy or some kind of discount with regards to validation processes. I think the appropriate person to have dealt with that is the Honorable Minister of Health, because the agencies that deal with validation of drugs and all medical consumables fall under his jurisdiction. Basically, those institutions are either the National Institute of Pharmaceutical Research, NIPRI, or the Nigerian Institute of Medical Research, and NAFDAC. These are the ones that deal with things that have to with consumables, food and drugs, and the processes of their certification. 20 million, I'm not sure. I'm not sure that is the amount. Like you rightly observe, most of the prescribed cure are on the social media platform. Nothing definitive. I read one article that alluded to the fact that we should give patients to be tried for a trial purpose. I felt that's not the way to go. The American equivalent of our NAFDAC, I think yesterday or so, had given authorization for a particular administration of a particular process. It must have gone through some processes of validation, and they are staggered in different stages. At this stage, this is what happens. At the second stage, this is what happens. Even the production of vaccines, that's what happens. It's not that the vaccine, the combinations for the production of the vaccines are not ready, but the processes of their examination and trial takes a very long time, so that we do not end up with the situation we ended up in this particular country of not too long ago. We had a situation, I think, with one of the manufacturers with regards to polio in Kano that became a subject of major litigation involving hundreds of millions of dollars that was eventually settled out of court through some arbitration or some negotiation. So no manufacturer will want to expose himself to those kind of contentions and litigations. That's why they allow it to run through a process. And even when they get to my little knowledge of the understanding of how it works, if when it gets to the trial level, for those that are going to be used for the purposes of the trial, there must be some kind of authorization received from those patients before those drugs or vaccines or any form of treatment is administered to them. So there are processes. My encouragement to our people, our researchers, and those that are involved in the processes of manufacturing drugs, especially our homegrown cure, they should be patient and they should run it through a process. And that is the only way we can have it validated. But I think when the question was to see if subsidy can be put in place, I think the Honorable Minister of Health would look at all these things, because we are so much in a hurry to obtain a homegrown cure. And all the countries of the world are doing similar things, trying to abridge even the processes of the trials to shorten the time. Ordinarily, from the little literature I've read about COVID-19, is that we are not expecting any vaccine to be on the shelf until 2021, towards the end of 2021. That's for even industries that have perfected the processes of manufacturing of this vaccine. I was listening to the CEO of Johnson & Johnson, who was saying that by the end of 2021, they should be able to provide the world with about a billion in terms of quantity of vaccines. Towards the end of 2021, we're in 2020, and this is the time that the COVID-19 is ravaging the entire world. But they are not in a hurry. to release those drugs. So my appeal to our homegrown researchers and those that are involved is let them be patient, let them go through the protocol of validation so that at the end of it, if their drugs or their syrup or whatever they produce is found fit for human consumption or administration, they will receive the appropriate certification. But in terms of the amount, the Honorable Minister of Health is here. He supervises those agencies. I know he will look at it if it's a thing that can be considered for discount. The other issue is with regards to the presence of the police. We will make it a point of duty probably once a week. We get one of the law enforcement agencies. We have permanently on the committee the Office of State Security. But most of the questions have always been in the issues of the police being the lead agency with regards to internal security. So they are always the face of the security and intelligence arm in this kind of situation. But let me assure you that we are working collaboratively even with the National Human Rights Commission. Yesterday or the day before yesterday, I got a letter from them addressed to the various departments and also the Minister of Police Affairs, cataloging the infractions on human rights conducted during the last 1 or 2 weeks. And it is expected that the agencies will respond to those allegations and processes of investigations will be put in place. So we take note of that. If that will provide our people some comfort, we'll try to shortlist them to also speak to the nation about what they are doing and eliciting the support of our people so that we can work in concert to deal with the issues as they arise. Hoteliers have written offering their hotels. Well, I think the Honorable Minister for Foreign Affairs will tell you of his experiences when he was now ready to get the hotels. It's one thing for the people to say, we offered our hotel. When it is time to get the hotel, that's when the issues begin to arise. But we are fortunate. Some understood the need of the time, and they made their hotels available. And that's how we've been able to bring in the number that we have brought in. And as we recycle these ones after the 14-day quarantine, the exit, the processes of decontamination of the hotels would be put in place so that we can receive a new batch of people to come in. I hope the states too will take note of that, because you can see that it's just because of the fact that it is the federal government that is handling the evacuation. If not ordinarily, all these provisions are supposed to be made available at the state level, and the state ought to take the responsibility of providing those things. Al-Majris sent back after having been intercepted, and you don't know, you see the interception, and when they are asked to turn back, but you don't know the next destination they get to. Well, I think invariably most of the times when they are intercepted, they are asked to go back to the places from where they are coming from. That's what I think happens, because that is the only destination they know, and they are always referred back to those various destinations. But as a matter of policy, the Presidential Task Force has stated several times that this is not the time. One, we have a protocol that says that interstate movement is banned. And this came as a result of input from the state governors. You must have seen the letter they wrote us, urging the federal government to make it of federal application, because that will carry more weight. It is different for one state to block its borders or to ban interstate travel across its borders. If it does not apply, if it does not have universality of application all over the country, the effectiveness will not be there. Now it's been put in place. So the subnationals that even requested for that should not be seen as the ones that are also disregarding what they requested for. Because if you say interstate travels are banned, except for essential services, I don't think the movement of Almajiris at this time is an essential service. So I prefer to leave it at that. So as much as possible, most of them have received, some have returned. And I believe that those who were returned like back to center from where they came from. Cattle rearers who were intercepted too in the process of moving across state borders, particularly in the south-south and the southeastern states. I've taken up that with the Minister of Agriculture and Rural Development because he has a subcommittee that deals with movement of farm produce, agricultural inputs, and the rest. And I've also taken it up with the IGP, the Inspector General of Police, because he leads the agency that is the lead agency in terms of facilitating the movement across the country. And what I need to do now is to ask for response from them as to what has happened with those situations. But it's a little bit difficult and complex because, like you saw the governor of Kaduna State climbing a truck and looking into the truck and finding people in the midst of foodstuff. So it creates a lot of problem even for the state administration in wanting to ensure that, yes, we allow for movement of foodstuff across our borders, but not with a large number of human beings that kind of defeat the intended purpose of the ban on the state travel. We will continue to make that appeal, that as much as possible, people should not be moved across state borders now, so that we can, as much as possible, reduce the number of movements. And finally, generally, we have spoken severally about the level of compliance, and it has always gone out as a word of appeal. And the question that was asked was, do we continue appealing? Why is there no enforcement? There have been enforcement all across the states, even FCT. They have set up mobile courts, and on a daily basis, people are being prosecuted, people are being fined, which is about the only thing we can do now because we don't want to overburden our correctional centers that are already overburdened with inmates. But I know that all over the country, there are mobile courts, and people are being tried, people are being fined, and people are paying the fine. And the next day, in defiance of the appeal, they still go out. And that is why we always want to be persuasive in our appeal. Because the danger it poses is to everybody. And I will make this appeal too. I can see a lot of order with the way media is set up here. But for those of you that had the privilege of being with us today, I think at the Dome, even the chief host had to keep insisting, keep social distancing, separate yourselves, don't cluster. So you see, it's a culture, it's an attitudinal thing that we need to really work on as a people to ensure that once basic rules are set, we should try to obey those basic rules and make sure that at least as much as possible, for our own interest and for the interest of the other people that we're supposed to protect and safeguard, we do the needful. So I think we will continue to make that appeal because we can never get tired of making that appeal. It is important, it is necessary that we take a collective responsibility of driving these processes. You can see that as much as we are trying, the figures are rising. That is explainable because we have ramped up our testing Today, at the Dome, not only did we commission a 300-bed facility, it came along with a testing lab that can test about 200 per day, and it can be ramped out to about 1,000 per day. So we are increasing the testing. And as much as you increase the testing, the chances of picking out those that are already infected or incubated is higher. And you keep seeing the figures rising. But it doesn't scare us, because that is the intendment, to get as many people who have been infected tested and confirmed, so that you can now isolate them and take them out of the community as quickly as possible, before they continue to infect others. So I want to thank you again and wish you a very good evening. Thank you.
Thank you very much, the SGF. That brings us to the end of the national briefing for today. Before we go, let's just share a message. Now that we are getting used to wearing a mask, we need to advise that sharing of face masks gives a false sense of security that could end up putting you in grave danger. Please, do not share your masks. Do not accept used masks. Always wash and iron your fabric masks, and at the end of the day, dispose your used masks by every day, every time. God bless Nigeria. We thank you very much. We hope to see you tomorrow.